What is your strategy for this phase, which seems at a policy level and a public persuasion level perhaps the most complex? People are bursting at the seams to get back out there. The variants represent real threats if they are to take hold and spread. And you now have the vaccine on the horizon. How do you calibrate your messaging for this phase?
I think you're absolutely right. It's this balance because people are so tired. They want to get back to coming together. They want back to, quote, life as normal. At the same time, people are fearful, and there's many people who don't trust the vaccine or the science. So we're doing a couple things. One is always message to people, while we have hope on the horizon and we're doing some tremendous things on vaccination, we still have to be careful. We can't go backwards. Second, as we roll out this vaccination, we have to make sure we are centered on equity and that those vaccinations get to the people who are most vulnerable and the people who have been hit the hardest, and that's our communities of color. They've been disproportionately hit by both the health impacts and the economic impacts. So we in the city of Seattle have been filling that gap with the limited vaccinations we have to date. And through our work, we've been able to, 70% of the vaccinations we're distributing, we've been able to get to those BIPOC communities who've been left behind. And then we have to reopen, and we have to remember, how do we come back together and do it in phases so that we don't have to go backwards again? And all of that relies on people trusting that we'll do the right thing. And we've seen that if we ask people to do the right thing, most of them will, because they care for not just for themselves and their families, but for their neighbors as well.
Mayor, thanks so much for being here. I have a question. Having lived in Seattle, we did a poll at PBS that showed 30% of Americans didn't want to get the vaccine. 25% were African Americans, but 49% were Republican men. I know Seattle, the politics there, but you're still surrounded by areas where Republican men in particular might be hesitant to get this vaccine. What should we be doing in your state, but also around the country to deal with that when it comes to the political divides on vaccines?
You know, we've been fortunate so far. We haven't seen that same political divide here. People have been very anxious across all demographics to get it, except for in some of our communities of color where there's reasons for distrust of healthcare, or they don't have connections to healthcare. They're furthest from healthcare justice. And so just this morning, for example, I went to a vaccination clinic that we did with cooperation of a couple of our Black churches and one of our Black senior centers. And it was primarily African-American older people. And it was so joyous to see people coming together, to see that they're getting that hope. And they will be the absolute best messengers to their community that vaccinations are the right way to go. Because right now we have a supply problem, but pretty soon we'll have the demand problem. And in order to reach the right number of people vaccinated, we've got to get people to trust in the system. And so I think you're right. We have to do it across demographics. And we're fortunate in this region. Most people have not viewed this through a political lens. But we're going to have to look for that and make sure that we stay unified in getting people vaccinated so we can reopen.
Madam Mayor, the stimulus is passing along very political lines with no Republicans signing onto a package that has over 76%, I think, support from the American public. What will you do with your stimulus dollars?
Well, first, it still just boggles my mind that that became a political issue. I mean, we've been in the fight for our lives in America, and we've got to unify around this fight. We won't recover unless we are together. And I don't understand how people can draw a political issue about getting small businesses and residents back on their feet, opening up schools, reducing child poverty. So we're going to use our money here in Seattle to really fill some of those gaps and build to where we can come back, because it's going to be hard for cities in America to come back and recover. Big employers have changed how they do business, which is going to make it harder for our small businesses to keep and be thriving. So we'll be using it for our most vulnerable. We'll use it for vaccinations, for people experiencing homelessness. We're going to make sure that we can tap into the rent relief that the federal government has, and really look for where are those things that are going to get us to not just coming back, but coming back stronger, better, and more equitably.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank all of you out there.
Thank you as always.
Thanks to at home.
Thanks for watching.
Thank you so much for letting us into your homes during these extraordinary times.